So it's nearly the end of this conference, 1 day and a half conference. But this afternoon, there will be possibility for you to continue by setting up some B2B sessions until 6 p.m. But to end this conference time, we're very happy to welcome Mrs. Monique Eloit. Monique Eloit is Director General of the OIE, and it's a great honor to welcome you, Mrs. Eloit, and to give you the floor for this final presentation. Thank you.
Thank you very much for your welcome. And of course, let me start by thanking the organizers of this conference for having invited me to bring the proceedings to a close. I also congratulate the quality of the speech of the previous speakers. I was connected for some time, and that is really well done. Thank you for that. Ladies and gentlemen, the COVID-19 pandemic serves to remind us of the degree to which human health, animal health, and environmental health are intrinsically linked and require cross-sectoral collaboration based on the One Health approach. It has also become apparent from managing the crisis that we should not longer be thinking solely of solutions to problems to specific disease. We need to think in terms of health system, and I will come back to that later. A pandemic is a disease even unlikely any other. It has an impact on our lives, of course, and economies, as well on diplomacy and international relations. It also calls into question our societal choice. Integrating the One Health concept into our policies will undoubtedly lead to more effective action. However, to achieve this, we need a long-term commitment of our global leaders and strong, well-structured multilateral cooperation. But before I start, I would like to recall some fairly obvious points that will give you a clear picture of the context in which we work as international organizations. I should also point out that we must simultaneously, even in French that is difficult to pronounce, address various challenges that complicate the management decision-making process, since we need to combine interests that often are difficult to reconcile. I shall mention only a few of these points. First, the global spread of new and emerging pathogens, which is unprecedented, and the identification of the globalization of movement of people and goods and animals, which is drastically accelerating this trend. You are well informed of that. But regrettably, the capacity of countries to prevent, detect, and respond to epidemic flare-ups is not uniform. Indeed, in a great many countries, it's often inadequate, which has implicitly and consequently the effect of spread to other countries and regions. Global supply chains have become extended, interconnected, and complex to the point where each health emergency even could jeopardize the global economy. Well, of course, international trade is considered as a potential pathway for the global trade of pathogens. But one cannot ignore that is vital for national economies and families' livelihood, and simplistic solutions involving closing borders are, from our point of view, unrealistic. Lastly, much has been said about transparency and information sharing. But let's not be naive. Publicly declaring cases of a disease, outbreaks, can have a major economic impact and political consequences, which may discourage transparency or, at the very least, delay the publication of the information. This is the context in which we now have to move forward from the concept to the operationalization of the concept, so that the words prevention, preparedness, and resilience of system will become a matter of everyday routine. But fortunately, we have already experiences in this field from which we can draw several valuable lessons. Thus, some of the actions designed and implemented jointly, such as the antimicrobial resistance strategy, the Ebola program, and other activities that we are jointly developed with partners such as WHO and FAO, have enabled us to identify success factors. Few of them. First, the need of a coherent strategy, setting out the responsibility of each partner. The importance of this strategy and its implementation plan being supported by robust scientific expertise and solid evidence. As the previous speaker, I'm quite sure are well aligned with my opinion. This does mean, however, that scientific results will need to be translated into recommendations, directives or policies that are both understandable and implementable. And that is something that is not so easy to do. Third, the identification and early involvement of the relevant actors, be they national authorities, private sector, or local communities. But we have also to assist these actors at local level so that they have the appropriate capacities. And not the least, political support to ensure investment and sustainability of the work. Now, from my previous remark, you can really deduce that we all have a role to play. Ownership of the One Health concept and its integration into policy is an approach that will certainly lead to more effective health actions. The commitment of international organizations such as the World Organization for Animal Health, but many of others, and in particular, what we are doing is crucial in this respect. Through our commitment to the tripartite plus, maybe you have already learned about this tripartite plus, namely the collaboration we have built with WHO and FAO and now with UNEP. Our ambition is for an action program that focuses on solidarity with our member countries so that they have the means to take ownership on this objective. And I do think that yesterday you could have learned more about this global plan for action. And for its parts, the World Organization for Animal Health is working to ensure that the veterinary services are effective actors in improved and strengthened global health governance. Within this framework, let me address two questions. First, how and why this concept is really a promising approach for more effective health policy actions. And the second question is, how does this translate into the work of international organizations and at the OIE in particular? First, in terms of more effective health policy actions. Moving from theory to practice, the paramount consequence of this concept is that its implementation requires working together by promoting cross-fertilization of the respective competence available within each sector, by sharing information and data, and by building synergies, leading to less duplication and fewer gaps. This means that instead of thinking, as I said previously, solely in terms of specific issues or specific disease, we should be thinking in terms of health system that is not clearly understood. And the latest declaration of the G20 health ministers adopted in 2021 under the Italian presidency, that was a very successful presidency. This declaration expressed a political commitment to this effect. And this marked a significant step forward. However, a political commitment needs to be backed up by governance structures if it is to be translated into an action plan. That is really the role assigned to the tripartite plus. I remind you that is WHO, FAO, OIE, and UNEP. And we are therefore finalizing our joint global plan for action. And therefore, that is the second point I should like to share with you regarding the implication for international organization. I think that is important here to point out that we cannot control everything. And all the previously mentioned challenges need to be addressed holistically and not one by one. That is why another concept, namely good global health governance, cannot be dissociated from the One Health concept. One Health concept and the global health governance. Bearing that in mind, we need to consider what can be done to improve this governance in our own sectors of activities, namely the veterinary services for the OIE, and then what we need to share in order to put the One Health approach into practice. In terms of veterinary services, based on the principle and standards on the quality of veterinary services adopted by our member countries, the OIE has developed the Performance of Veterinary Services Pathway, the PVS pathway. That is a program for the sustainable improvement of veterinary services worldwide. The PVS pathway gives the national veterinary services the means to act according to their strengths and weakness. We don't act on behalf of them. We provide them with the means to improve their own capacity. And this enables really countries to take ownership and prioritize improvement to their animal health system. This program has therefore been designed to increase countries' engagement. And for maximum impact, it is supplemented by sub-regional training and orientation workshops, self-evaluation workshop, as well as targeted support missions on topics such as strategic planning. Today, I'm very proud because around 140 of our 182 member countries are engaged in this program at different levels, of course. But with this experience we have acquired through this program, we have a better knowledge of our member countries' needs, and therefore we can advocate more effectively for a global action plan with our partners. We began modestly, certainly, but ambitiously, and in 2010, long time ago, no, by choosing, along with WHO and FAO, 3 priorities of collaboration. At this time, the most important was the control of avian influenza. And now we are talking more on animal influenza. But rabies and antimicrobial resistance were also on our agenda 10 years ago. Since then, we have progressively consolidated our collaboration. And in October 2017, the OIE, NFAO, and WHO, only the 3 partners at this time, released their second tripartite strategic document, reaffirming their commitment to provide multi-sectoral collaborative leadership in addressing health challenges. And the scope of our collaboration was enlarged to more broadly embrace the One Health approach time after time. And among the many topics covered, one focus on the reinforcement of national services in human health, animal health, and food safety. And my colleague yesterday afternoon provided you with more information on this action track. A concrete example of the work and materials developed by the tripartite organization to support their members in advancing their One Health capacity is a guidance document published in March 2020. Maybe you have already been informed about this document, which is titled A Tripartite Guide to Addressing Zoonotic Disease in Countries, and that is now really better known as the Tripartite Zoonosis Guide. However, the topic on which the most work has already been achieved is antimicrobial resistance, AMR, for which we have a cohesive strategy thanks to an harmonized action plan, clear leadership, and governance on the implementation of the strategy. We have also shared database, and that is also something important, a joint financial mechanism for collecting the funding and prioritizing the project. And that is a hope I have with the future global plan of action we are finalizing with our partners, WHO, FAO, and UNEP, so that our the political commitment of our policymaker could be also translated into actions. So, dear participants, I know that yesterday you have been better informed on this global plan for action that we are finalizing with our partner. Therefore, I will not longer elaborate on this issue, but I would like, however, highlight that an important component of this global action plan will be to strengthen the One Health capacity of the health system, of the health services. And for me, that is always very important to remind that health services is not only for human health. We have really to consider the full integration of veterinary services and provide them with adequate guidance and tools for an effective implementation of this multi-sectorial approach. We are now talking about so many months and sometimes so many years. We are already working with WHO to develop joint training courses through the OIE WHO collaborative learning framework for the One Health workforce. That is why I hope that the WHO Academy, which should open very soon in Lyon, will be really a fruitful partner for the OIE. We are committed to develop One Health learning opportunities together, and I hope that very soon strong collaboration with our OIE training platform, which is currently hosted by the VetAgroSup, thank you for that, that this collaboration between the WHO Academy and the OIE training platform could also become really a reality. That is, for me, the time to conclude my remark. Firstly, to thank again the organizer, but also to salute the initiative taken in 2020 by local partners to set up this veterinary public health hub. All of us well know that Lyon, the region, Lyon Métropole, are recognized as a center of excellence in the medical and veterinary field. And therefore, and particularly after this conference, I'm really confident that it will have a promising future. So ladies and gentlemen, don't forget that health is a global public good, since protecting global health is also a factor for peace, security, and prosperity in the world. And today, probably, this is also very important. Access to health for all is a shared challenge. We have to act together in solidarity to achieve this. Thank you for your attention. And once again, congratulations for this conference.
Thank you very much, Monique Eloit, for your presentation, your concluding remarks on this wonderful One Health conference. Thanks a lot. I think it was the best conclusion possible after all the debates, exchanges, questions, and this will to go forward on One Health, veterinary and human aspects. And I think that everyone is so now motivated to carry on. So thanks to everyone for being connected during 1 day and a half to attend these conferences and the presentations and roundtables until this conclusion. And you can carry on getting in touch with each other thanks to the B2B session, which will last until 6 p.m. You can connect on the B2 Match platform to get in touch with each other. And of course, even if this conference is now over, you can still get in touch with the hub, VPH Hub, thanks to a website and of course the social media. So we remind you of various ways to connect with the hub on this last slide. And on behalf of all the organizers of this conference, the 9 partners of VPH Hub, I wish you a very good day, and I see you very soon. Thank you very much. Bye-bye.